get started with our panel discussion. So we have three experts in various fields joining us today. And they're going to be giving their thoughts on return to work and the state of things overall. We would encourage you as attendees to use the Q&A function to ask questions throughout. We definitely want this to be an interactive experience, and we look forward to speaking with all of you. So I'll just briefly introduce each person, and then I'll kick it off. We have Adam Callie, who's an HR consultant from Human Capital. Matt Neiman from Jackson Lewis, who's a labor attorney, and then Kamran Riazi, who's a principal with OPX. So thank you for joining us today and adding your insight. And with that, we're going to go around the horn for each panelist's view and their respective area of work. And we are going to start with Kamran. So Kamran, if you could introduce yourself and share what you're seeing.
Thank you, Will. Hello, everyone. I'm Kamran Riazi. I'm a principal at OPX. We are a design consultancy in Washington, D.C., and have been in business for 37 years. We've built a practice around helping our clients' businesses work better. Now, during this current situation, this has presented all of us here today with a very daunting challenge in our efforts to advise our clients and to fulfill our ultimate role as an advisor. Partly because the nature and definition of this help that we strive to give is far less certain, but also part of it is because their need has increased exponentially for this help and advice. And finally, because we really can't reach into our bag of experience-based answers to pull one out and give our clients, because this hasn't happened. So our clients are all pondering, when to go back and how to go back, or even if to go back. They're faced with questions of not only what to do in day one, but how will their day two and their day X be any different? Many realize that what their organization did or could do 2 or 3 BC, that's before COVID, may no longer be relevant or possible or even competitive. So the question that they're facing is not how to restart their engine, but it really is where they're going and can they survive the trip. So how do we, the professionals, provide the answers that they're desperate for? I think therein lies the million-dollar point. No one knows the answers fully. So what do? Is there help that we can kind of give our clients? Is there a way that we can kind of guide them through the discovery process to find the right or right enough answers? Plato said it's sometimes more important to ask the right question than to have the answer. So part of the real value I believe we can bring to the table is help guide our clients getting the information they need to succeed, and they need to make the right decisions. As we all know, one of the most expensive aspects of any business is their payroll. But it's also equally true that one of their most valuable assets is their employees. I mean, now more than ever, we have to have in mind that no matter how unpalatable the idea of paying rent for an empty office may be, it does not rise to the level of employees' well-being, productivity, efficiency. I mean, without them, there is no organization, there is no company to worry about. So wouldn't it make sense to find out how employees are working during the quarantine? Have they become more efficient? What do they think about going back? What do they think what do they think they can or should do when they go back? And what do they expect to see or have when they go back? I mean, these are critical questions, and we really need to help our clients have the answer to those. Peter Drucker, you probably have heard of him. He's a renowned management consultant. Once said, if you wonder what people are doing, ask them. So this data gathering exercise will allow the leadership not only to increase their chances of a successful return, but also to reinforce and create a positive culture. And we know that positive and cohesive culture is now even more important than it used to be. And it also allows them to help, allows the leadership to plan better for the midterm to long-term future, because that will also be different. Now, some clients may take the approach that, you know, our organization will dictate, and I don't necessarily say this as a judgment call, but they may say that our organization will dictate what the solution will be, and our employees will follow that because that's the job, that's their job. Well, the problem is that that solution may be very wrong because there's no model for what has happened, and also that some of these solutions may be wolves disguised as sheep. We often find workarounds in organizations because we have to get things done, not because they were designed to be doable, and because we had no choice but to get it done. And sometimes this efficiency is not easy to see, so organizations will take it as just the way things are. So we have the responsibility of creating solutions for our clients that do not require heroic workarounds, because they might just stick forever. One of our former clients, a senior producer at ABC News, walked into his newly designed by us workspace, and as a way to compare it to what he used to have, he said, boy, you have to be careful what you get used to living with, because you can get used to anything. So on that note, thank you. I'll get off my soapbox.
Thanks very much, Kamran. Good way to kick it off. So moving along, next up, we're going to hear from Adam Callie.
Good afternoon, everybody. I was just chatting with my colleagues here before we began. This is my 6th COVID-19 webinar. I'm hoping that we all just get healthy and I don't have to talk about this anymore. I do not think I'm going to be that lucky, though. So we've got some good material prepared for you. Give me one moment. I'm just going to bring up some slides here that we're going to go through together. Okay, can you all see my full screen slides?
You can.
All right,
Yeah.
Beautiful. So away we go. My intention to sort of piggyback off of what Kamran said, and also to set up a few things that my buddy Matt is going to say, is to begin with this idea that we should rethink our reopening. Like, should we even be doing it? And then if we are, again, piggybacking off of my predecessor, what are the steps we should analyze? What are the procedures and processes we should think about? And what I'd like to leave with is a bit of a sobering statistic, and that is 58,000 service members died during the Vietnam War. So far, 91,000, nearly 92,000 service members, those service members being every American, because we're all combatants in this event, have died. That is current from the CDC as of today. Now, I joked a second ago that this is the 6th presentation I've done on COVID-19. When I showed this very slide 1 week ago, the number was 80,000 and change. So we have had about 11,000 more deaths from last Wednesday to today. Question of the day: should you be opening knowing that this disease is still very prevalent? And use these numbers to drive home to yourself, and you're on this webinar, so you're very aware, but drive home to your leaders, your colleagues who are not on this webinar and may not be as aware, drive home to them that reopening may not be the right move at all yet. But if there are business reasons why you must reopen, that's fine. I'm a man of business. I get it. Do so with the proper precautions in place. little statistic, little quote for you from the New York Times. See, I'm putting on my glasses, so you know I'm being all professorial here. You got to pay attention. About 2/3 of Americans are worried that states are lifting restrictions prematurely, saying it is too soon for businesses such as retail stores, movie theaters, gyms, restaurants, etc., to reopen. This is also taken from a Washington Post, University of Maryland poll that the Times then quoted. Came out May 5th. 68% of the people polled believe that the worst of the pandemic is yet to come. So I pose the question for each of you to ponder: should you be opening yet? Excluding New York City, cases in the rest of America are steadily rising. Modeling from the Center for Disease Control and Prevention predicts that new cases will rise by 20% in reopening states, with 100,000 more deaths expected nationwide from the coronavirus by early August. Again, I presented last Wednesday. The statistic was 80-something thousand. I'm presenting today. The new statistic is 91. Doesn't seem unreasonable to me that we may hit 100,000 more deaths. Not 100,000 total, 100,000 more from May 5th, which was the time of this poll, to early August. More than a month has passed since there was a day with fewer than 1,000 deaths from the virus. Almost every day, at least 25,000 new coronavirus cases are identified. The United States is the #1 country in the world for diagnosed cases. It is your decision whether or not this is the time to reopen. It is also your responsibility to protect your people and your liability if things go badly. Now, fortunately, we've got Matt coming up. He'll be addressing the legal aspect of this. I'm just teeing him up. But remember, responsibility, liability rests with you. Just because the president, the governor, the mayor, or whoever said you could reopen, should you reopen? Well, as you think about this, I'm going to give you some things to think about. First thing I want you to think about is workforce issues. Depending on your particular workforce at your organization, blue collar, white collar, large, small, the demographics of the makeup of that workforce, those might influence you one way or another as far as if you should open or not. Another thing to think about, and actually I believe Cameron mentioned this briefly, is your organizational culture. There are companies out there that are very democratic in their decision making. And if that's you, that's great. How are you involving your staff in deciding, is this the right time to come back to work or not? Are they comfortable coming back to work or not? We'll talk more about that in a little bit. Another thing that's important to think about is, are your work styles, again, tying into your cultures, being inhibited by the fact that you are currently a dispersed workforce? Maybe you're very collaborative. You get a lot of work done that way. Right now, everybody's working from home. You may not be really clicking on all cylinders like you usually would be. I understand that's a concern. You should absolutely consider that, and you weigh it as part of the total assessment. Another thing to think about, because we're not just HR people, we are business people who chose to specialize in HR, and we've got to understand the business side of things, the economic side of things. How has telework or being closed impacted the economics of your organization? Can you stay in business working the way you are? And if so, for how long? How much is it holding you back? The fact of the matter is, you go out of business, you won't have to worry about this issue, will you? Nobody will be coming back to work because there will be no work to come back to. So if coming back to work is what's going to enable you to work, I get that. It doesn't change the fact that you need to weigh your PPE, your structure of your facility, etc. We'll get to that shortly. But don't overlook the economics when you're only looking at PPE and employee culture, etc. And of course, setting up my buddy Matt again, law and risk. There are things that you have probably encountered in your readings, in other webinars, conversations with your colleagues, etc. Things like OSHA standards, ADA accommodation standards, what the FFCRA mandates for paid sick leave, for expanded FMLA, and again, more to come from Matt. You're going to look at all of these things, but it's not just you, the viewer out there who's watching me live or watching me recorded, who needs to think about this. You need to take this to your leaders who are collaborating with you on making these decisions and break it down step by step for them so that you've thought it through properly. Because you're going to need to communicate this to your staff. I want you to look at this and I want you to imagine it is a Memorial Day holiday traffic jam on the Beltway, because that is what this connection of all these issues is like. You're at the center of it. Now, the good news is that our friends at the CDC have developed a flowchart specifically for workplaces to consider when they're analyzing reopening. FYI, there are other flowcharts that they have designed for other specialty type businesses. This is just their generic workplace flowchart. So I know it's a little small. The intent was not for you to read it. The intent was for you to know it's there, go to the CDC website, get it. You can read through this, and again, share it with your colleagues, because this is good guidance that's going to help you to make effective decisions. Now, the White House and our governors are talking about reopening the country in phases. So I borrowed that idea and said, well, why don't we use phases to set ourselves up, to do our thinking, do our analysis. We're going to do a phase-by-phase assessment of the reopening, whether we should or not, and if we are, how to do it. So the first phase that we're going to talk about is your pre-return phase. Are you squared away with your vendors, your workspace, and the supplies you need? Second phase, still pre-return, we're going to talk about surveying our staff. Now, Cameron talked a little bit about asking your people, right? He said, Peter Drucker said it. Hey, if Peter said it, it's good enough for me too. But my buddy Matt's going to tell you, if you ask the wrong questions or you act the wrong way on those surveys, you might be creating more problems for yourself. We'll get to that later. And then, of course, involving your staff, communicating with your staff. And when I say staff, I also want to specifically carve out your managers. We'll talk more about that when we get to that slide. The next phase, third phase, yay, come on in, we're open for business. What does that look like? Then be prepared to pivot. And finally, risk management and the just-in-case phase. So here we go, phase one, the pre-return. From a vendor point of view, have you spoken to your office cleaners? Are they ready? Your office has been empty. Nobody's been there. They weren't cleaning it. Are they ready to begin servicing your space again? And not just serving it the same way they always used to service it, but now service it at a heightened level. I want them going through this place with like flamethrowers, killing everything. Okay, flamethrowers is not really good. But you get my point, right? Next vendor you need to talk to, your building managers. The building's been empty or largely empty. What are they doing? Are they ready for more occupants to return to the facility? Next thing I want to ask you about physical changes. In my network, I have an organization that's a handyman service. And in talking to them recently, they were discussing how they've gotten a lot of business from COVID-19 because companies have been inviting them in to put up different types of barriers and separations between these open workspaces that we were all working towards for so long. Now we need barriers. I heard a funny story from Cameron when we were preparing for this session. He was talking about one client that wanted to rip up all the carpet in their facility and replace it with tile floor because they felt it would be easier to disinfect. Now, I'm not telling you you should tear up all your carpet, and I don't think he would either. But this particular client made that decision. What decisions are you making so that the physical structure of your facility is going to lessen the likelihood of disease transmission and increase the confidence and comfort level of your staff? Of course, the no-brainer in all this is PPE. What have you got available? Do you have masks? Do you have gloves? Or are you going to tell your employees it's their responsibility to take care of themselves? That's not up to me to decide. Ask Matt. He might tell you, oh, you want to do this, you don't want to do that. But it is definitely a concern. And of course, with that, you may want to even consider things like cleaning gear. Maybe everybody comes back to work on Monday and you issue them a sponge and a spray bottle. I don't know. Welcome back to work. Here's a sponge and a spray bottle. So that as you're going about your day, you can kill any disease that gets anywhere near you. Sounded crazy in 2 months BC. I'm borrowing that term from you, Cameron. I loved it. 2 months before COVID. But today, that doesn't sound so unreasonable to me. Just thinking. Also, traffic flow. You know, you go to the grocery store these days and you know exactly what I'm talking about. You walk around, you see the aisles have arrows on them. And of course, don't be one of those knuckleheads who goes the wrong way. You got to follow the arrows, right? but at least we tried to put the arrow down. We tried to keep the traffic flow in a certain way. And if somebody chooses not to follow that, what can we do? And of course, you may have public areas. Here I'm thinking of course, lobby areas and kitchens, break rooms, things like that. Are you going to close those? I'm just an HR guy. I'm not a doctor, but I'll tell you, if it's me, I'm closing that. I don't want everybody using the same refrigerator, the same microwaves, etc. That's me. No more coffee. No coffee till after COVID. Again, if you revisit that flow chart that I showed you from the CDC, it encourages you to assess these things and make these decisions. Moving on to our second phase, still in pre-return, talking about surveys. I say that this is a time to collaborate, not to dictate. Can you collaborate with your staff and get their ideas and get their input on what they should do and what they want to see, so that they'll be more comfortable in the workplace? And you don't want to ask this on Friday when everybody's coming back on Monday. You want to ask a few weeks ahead of time so you have time to rip up the carpet, or of course to put in these different shields that our handyman friends can do. Now, when it comes to surveying, as I said, it can be dangerous. Don't survey anybody unless you're prepared to act. I would have told you that 3 years BC, and I was just talking about normal engagement surveys. You bet I'm still saying the same thing to you today. Because if you ask them, what will your challenges be? What are your concerns? Well, the good news is if you know, you can act on them. The bad news is if you ask it wrong or you don't keep the information anonymous, my friend Matt's going to tell you, you could be exposing yourself to some sort of family discrimination, right? Oh, well, I have kids and I can't come to work. Oh, okay, we'll fire you. Oh, well, you discriminated against me. Clearly, none of you would be that bad, but you get my point. A little exaggeration for humor's sake, but you get my point. We want to ask them, well, what are the things that would make you feel safe and confident returning to the workplace? Because then maybe you'll know, build this, change this, fix that, modify this procedure. An example that I gave in a prior webinar was issue equipment to individuals, where people maybe normally share equipment, and that was never a big deal. Now everybody gets their own equipment because now I'm not touching your screen and you're not touching my buttons, and there you go. So if you have equipment that's commonly shared, is there the opportunity to limit it, or maybe limit it to only 2 or 3 people who share it, so it's not shared among dozens? Of course, written communications are important. Again, I'm still in the pre-return phase. So what are you sending out to your employees, and what are you sending out to your managers? Those messages should be very common, but your managers are different. Your managers are the people your employees go to for guidance, and in this case, for comfort. How are you equipping them to do this job? Because again, as my friend Cameron said, none of us were equipped for this. Everybody's figuring it out as we go. And you are the employer, so you need to guide your managers so your managers give the right messages to the employees. So think about that. Of course, from talking about communications, we want to go right into training. How are you preparing your people to come back to work for the new normal? Both your regular staff as a general statement and your managers specifically. We want to help them to succeed, and if we don't give them the right training, well, then good luck. Policies, procedures, all be changed. My buddy Matt here is from Jackson Lewis. Last Monday, they put out a great piece about EEOC and ADA guidance on accommodations. And what you might normally have done 3 months BC, how does that change in light of a global pandemic? Because it's different. So you need to read those things, you need to know these things, and then you need to share it with your leadership so that you can be prepared to act, not only in general for the organization, but for people's specific individual needs. And I might argue that you should get written acknowledgments for some of these things, for some of the written communications you send, for some of the training. I mean, come on, guys. You are HR professionals. You know, we give out a handbook, we give out policy change, we give out a new sales compensation structure, we get a written acknowledgement of it. So if I'm putting out some of this kind of stuff, I may want that same kind of acknowledgement so that I can prove they knew. Just a thought. I leave it to you to reflect on. Now let's talk about, come on in, we're open for business. Again, go back to that CDC flowchart because it talks about Once you reopen, what are the things you continue to do while you open, right? Things are back to normal. Note my air quotes there. What are we doing to make sure we continue to stay safe, right? What are we doing to continue to comply with FFCRA? Because that law does not sunset or end, if you will, until December 31st. So I don't care if you go back to work next week. So what? People are still entitled to their paid sick time, which you get tax credits for under FFCRA, and they are eligible for expanded FMLA. Now again, this is not an FFCRA primer here. We're not going into all the details that relate to that. So I'm speaking in broad general terms, and I'm not even discussing whether you've exempted yourself from the EFMLA part. Just know that that law still exists, and it may have a bigger impact on you if you're all back in the workplace than it did when everybody was back at home. Processes and procedures. Are you limiting visitors? Are you changing how you handle vendors and deliveries? What about business travel? Yeah, right now that's a joke, right? Nobody's traveling for business. But if you're coming back to the workplace, is that going to necessitate some even local business travel? Think through all these things. And again, I'm not a doctor, I'm just an HR guy. But my advice to you when you come back to the workplace is get ready to leave the workplace again. When March 18th came, or whatever the exact day was, it all blew up. None of us were ready. We all went home in a hurry, had to learn Zoom, had to try to remotely install VPNs. If you have staff who could really use some training, or if they need some upgrades on their laptops or whatever, take advantage of the time you're back together to get ready for the next time that you aren't. Anyway, lots of things to think about, fun stuff. Now, you're coming back to work. Is it gonna be just the way it was? I don't know, but I would argue probably not. Are you gonna have new marketing methods? Are you offering new products and services? I'll give you a simple example. I have 2 teenage daughters who were signed up to take 3 different weeks of Girl Scout camp over the course of the summer. All those camps have been canceled. I'm sure you're not surprised. But all of those camps are looking to find a way to deliver an online virtual camp experience. It's clearly not going to be the same. Nobody's making s'mores remotely here, people. But they're still trying to find a way to deliver their product, i.e. camp, remotely. Also, I'm sure they want to generate some revenue, and there's nothing wrong with that. So how is your product and service evolving in light of COVID-19? Are you working from new locations? Are you pursuing new customers? Maybe you've got to go after customers you didn't go after before, because right now every customer is worth having. Maybe your pricing is changing. Your people, they can't come back thinking it will be what it once was. The world is changing, like it or not. I'm going to give you a quick example from a company we all know, Walt Disney. I'm taking you back in time with me. During World War II and before World War II. Before World War II, Walt Disney Studios was known for making classics like Snow White and the Seven Dwarfs. I'm confident that most of us have seen that. If they're not, we at least know the story. But when World War II came along, all of a sudden their #1 customer was the US government, and they even did work for the Canadian government. And they went from making animated classics to making videos on things like how to put up a tent, and how to throw a grenade, and how to stay clean in the, the Pacific jungles, right? They had a whole new customer base, a whole new way of delivering their product. You got to pivot. What are you doing to pivot? How are you preparing your staff to pivot with you? As we get close to the end here, I want to talk about risk management. What do you do if a staff member gets sick? When you got sick at home, with all due respect, and I say this as a nice, caring HR guy, so what? You were at home, and nothing I could do about it, and it didn't have any impact on us other than you can't work right now. But now when you come to the workplace and you get sick, I've got a crisis on my hands, because I've got to track all the contacts you made, and I've got to figure out if I have any risk or liability, and I also have to figure out how to keep my workforce healthy, because if other people get ill, we may not be able to deliver our products and services. Be prepared for that. You're bringing them back. You're raising the likelihood that they may bring the disease with them. And as I mentioned earlier, what if there is a second wave? This is the time to prepare for it. We did not have the luxury. We didn't know last time. This time we know. Get ready. A few little minor HR things here that I'd like to mention. if you have been working remotely and you hired anybody during the last 60 days or so, well, you could not onboard them the same way you always used to. It was different. It was done remotely, right? And one of the things you were allowed to do by our friends at the USCIS was to check ID for I-9s in a limited way. And the full detail about this is found at I-9 Central at the USCIS website. Well, they gave us all 60 days. It was supposed to expire May 20th. That was yesterday. But the good news is they gave us 30 more days because COVID-19 hasn't gone away, during which we can still check ID by allowing them to give us a photocopy or look at it on our camera. But once you resume your normal operations, you have that good old-fashioned 3 days to see their ID in person. So if you've hired anybody, you will reopen your office within the first 3 days of being back in the office. They need to bring you your ID or their ID, and you need to handle it according to the new process that is allowed. So keep an eye on that. Want to keep you out of trouble. For those of you who have employees working in DC, this was already planned last July, that this July, the new DC Paid Family Leave Act was going to come into effect. Well, July 1st seemed awful far away back in March, didn't it? Doesn't seem so far away now on May 21st, does it? Talking 5 weeks or so. So if you have people who are ill, become ill, or whatever, that have family members who become ill, and they're in DC, they may be covered by the Paid Family Leave Act. This is not a detailed exploration of that law, but I will tell you, I popped on the website earlier, and you'll see I put a little screen capture here of the FAQ that they have out, specifically explaining how COVID-19 and the DC Paid Family Leave Act intersect. And I nicely gave you the link right there. So if you ask me for my slides later, I'll send it to you. You can click and go. But don't forget, if you don't have people in DC, hey, don't worry about it. But if you do, this is coming. Now, this is not the first time I have talked about this subject. I've been on TV, the radio, satellite radio. I've been in articles by people you might know like SHRM and Business Insider. I'm not going to go through all that. I've provided you the links. If you'd like to know more of what I've had to say before, you can check it out. And at this point, I would just like to say thank you very much to Will and the Dulles SHRM team for inviting me to be a presenter with these two esteemed colleagues. And I'll be happy to stick around for questions after Matt's turn. So Matt, thank you very much. I'm going to stop sharing here and hand the baton off to you, my friend.
Good afternoon, everyone. Hope you're all living your best lives. Taking up the cleanup spot here to talk about how the law makes our lives that much more livable, or something like that. I don't have any quotes from Plato or Steve Drucker or even Elmer Fudd, but nevertheless, laws are like guide rails. They don't tell you where to go; they tell you where not to go. So they don't tell you what to do. And frequently, every day you look at the news, the CDC has a new guideline, or the state has a new plan on this, or people are protesting that. We live in the employee relations world. And making sure that your employees understand what is going on is frankly a whole lot more important than what you actually choose. Now, in doing that, you need a plan. Now, the plan should account for things like leave laws and the PPP loan that you may have taken out, or changes from OSHA or anything else like that. But if you are relying upon a groupthink session where you're all going to write things on a whiteboard, even figuratively in this Zoom world in which we're presently living, that's not good enough. And the reason for that is, as you go through making up that plan, you will realize the things that you have forgotten. It's the same difference when you're talking to one of your children, or you can reflect upon your time in education where you've got all those ideas for that term paper in the top of your head. And you realize that somehow the difference between having it coursing through your brain between your ears is not quite the same as being down on the paper, whether that's with a pen, a pencil, or typing it out. So making that plan, even if it changes the moment you start putting it to effect, is critical. And part of that is just you don't realize what intersects with other things as you're doing it, because there is, frankly, not even yet, a new normal. And that new normal will people be measuring themselves against. And different people, as you all know, care about different things. I'm asking this by way of, query, I don't need a show of hands or anything else, but when's the last time you wore pants? Did your dress code when you were working in the office include wearing shorts with any portion of your time? That is literally a question which people will want to consider. I mean, you can talk about whether you want to douse them in 9 gallons of alcohol to kill whatever germs might be there nearby, but people care about themselves. We talked before about whether the refrigerator is going to be used the way it was before, or the coffee machine. Is there a common area? Well, maybe there is, maybe there isn't. I don't know what your culture is. Your culture drives a lot of this, but you're also a business. And if you are stuck in a loop of people can say whatever they want, and that's where the plan goes, or it isn't a plan, that's where liability will find. The guardrails are going to be there. The guardrails can be crossed over. It's not like people set out saying, man, I want to be discriminatory in this. It just happens when people take facts which have occurred and apply them to what has happened beforehand. So as you're making up your plan, you have to think about all sorts of things, including who goes back first? And think about that. We can talk all in great terms about how you're going to make your office, hermetically sealed and no bug dare show its face, or we'll eradicate it with 19 kinds of PPE. But who's the intrepid explorer who gets to go there first? If there's been people who have never left the office because you're on an optional work from home and they decided they have no internet at home and they've been there the entire time, how does that work? Do those people have to get rotated home if you're going in staggered shifts? If you're coming up with criteria for who goes back first, you got to make sure those are neutral and non-discriminatory. Now, normally when we think about things like disparate impact, we're talking about a RIF and letting people go. Well, here we're talking about bringing people back. And we're not even talking about rehiring them. We're talking about saying, hey, you should come back from your house first. And maybe people are saying, oh, I've got kids, get me out of here. And you got people who also got kids who say, oh, please let me stay. And you can't treat those people the same because they're not the same. But as Adam alluded to before, their kids have nothing to do with it. Furthermore, this is not work from home in the traditional sense. You've probably seen 1,001 articles about how this is the new normal and look how teleconferencing works and I can work remotely. When the government doesn't let you go to your office, that is not the same as I really love working from home. If you had asked me 80 whatever days ago, did I want to work from home? I would have told you, and I'll tell you now, I don't like to work from home. Doesn't mean I can't. It doesn't mean that I want to. If you read the New York Times, they had an article recently about the value of being in the workplace, being in the office, and how some of the best ideas we get are from unplanned encounters. There's no such thing as an unplanned Zoom encounter unless you click the wrong link. There is the chance of the occasional 2 people gave out the same dial-in number so that you end up on a conference call and you're wondering why there are conflicting voices and wondering who that is. Which I must say, as an attorney dealing with confidential matters, having extra beeps and voices is a little disconcerting. But putting this all in perspective, you have to think, what do we do? This situation, whether talking about return to work or otherwise, has given us an entirely new perspective on how our business can run. Not that it should run, or that it has run, or even how it might run, but what can we do and what do our customers want? If your customers aren't going to come into the office for the rest of the year because they think they're going to get COVID-19 by coming to your facility, what's the rush to reopen? But along the same tokens, don't ask questions you don't want answers to. If the company is going to do X, you don't need Y, Z, and anything else to have as an alternative because that's what's going to happen. That has a lot to do with who your leadership is, how much collaboration they want. But you need to ask the questions that you want input on and provide clear guidance on the ones you don't. That includes making sure that everybody, especially in management, is on the same page. You don't need to have an email that goes out, which is followed by 800 chat messages about, I can't believe we did this, and tearing it down, because your culture can be shredded by people not being on the same page. And especially when everybody in the world is having driveway meetings with their buddies to talk about what's going to happen next, and that can give you any predictable date that you want between now and never as to when things will resolve. So the good idea factory is a great thing, but it has to be shut down when it comes time to actually execute things. There are policies, there are practices you're going to have to change. You're going to have to remember the things that were spun up for COVID-19, like the Family First Corona Response Act, will keep going, but not forever. And if somebody just gets, I know, wait for this, just sick, not COVID-19 sick, they still have the possibility of an accommodation. If they need to care for a loved one who tripped and fell, there's still FMLA. Who knows what's going to happen with DC paid family leave? 3 years ago when they passed it, we didn't even think it would ever take effect. And now they have COVID-19 to add an extra degree of difficulty to how DC always smoothly handles bureaucratic matters. I'm confident that the fact that there are job postings for what are seemingly all the critical roles to make the law work, and we are 40 days out, couldn't possibly have an impact on how smoothly that rolls out either. But with all those things in mind, we're looking for that new normal. It's going to evolve. Think about what you do. Think about the laws that come in there. Think about your dress code. We're coming back in the summertime. Perhaps a way of cushioning the blow is that over the course of the summertime, people can wear their shorts back. You're still winning hearts and minds, even if this is a wholly unprecedented situation. You have to have directions because people are going to ask questions. But you also have to be aware of what's going to go wrong when you get back. What about non-exempts who are used to working from home but now want to build things that are off the clock? You still got to handle it. What about people who are perfectly capable of coming back to the office, but they prefer to work from home? Now, they may say, I just want to prefer it, and you can have that conversation. They may say, I don't think that there's anything you can do to make me comfortable coming back to the office. Because now that we've sold fear, you now have to unsell it. That is an incredibly difficult thing to do. And many of the things that we're talking about, whether it's disinfection or anything else, is all about making sure that people are comfortable. And when multiple levels of the government are telling you, if you walk outside and dare wear your shoes inside the house, you may have to crack out 3 bottles of Clorox. It's hard to turn that around and say, come on back. Don't you trust all your coworkers? And I was talking to one of my colleagues, at a safe 6-foot distance at the end of my driveway, and he was noting their entire office, even at capacity, could have 100 people. They have 500 people on their team. And it was largely arranged with a countertop that ran down the middle, which was not even a little spit guard. They just lined up their laptops and collaborated. Well, if you're going to go with a staggered opening and you can only have a third at a time, that means that of their 500 people, it may take 5 months for someone to actually hit their shift to come back to the office. And what exactly purpose would that serve? It's not like they're sitting around for the previous 2.5 months going, what should I do? What should I do? So have the plan. OSHA is going to give out new advice. The CDC is going to evolve as what it is. The states are going to say what they're going to say. Here in Virginia, maybe Northern Virginia will accept themselves forever. We just tend to punt ourselves out 2 weeks at a time to make your planning that much more complicated. But realize that some of the things like virtual happy hours and things of that nature have significant value. They are your company because your people are your company. You've got a product, you've got software, but the software, in case you haven't noticed, isn't doing a whole lot without the people pushing it around. So with that in mind, I will defer off. I'm happy to provide you with some checklists of things to consider, but do please chime in with any questions. We've got the Q&A tab to chime in. I know that we've gotten some questions in the interim, so we'll try and work our way through that. But life's too short. Don't wear pants.
Love that line.
Thanks, Matt. So I don't see the Q&A on my end. I don't know if it's an issue with me, but if there's questions coming in, it's Matt. Oh, here we go. So here's a funny one. Do we have to go back, and what if an employee refuses to come back? So I guess, Matt, I'll start with you, and then Kamran and Adam, if you want to weigh in as well. Oh, are you on mute?
Can you hear me now?
Yeah.
All right. Today is May 21st, according to my computer. It feels like March 84th. I haven't been in the office since March the 13th. So you don't have to go back because you can actually do your work. You have to decide when that is and if it's necessary. You may have some people that you've gotten out of your lease and you decide I don't need all that space, in which case your return to work plan is not a matter of getting physical bodies back in physical seats, but instead saying this is our new normal. Now, the flip side of that is the other part of the question, which is what if somebody says, I don't want to come back? Well, there are a lot of steps before you pull the trigger and say, therefore, they're no longer part of our organization. And we are nowhere near the end state where I think that's the conversation you want to be having. However, you are the boss of them and not the other way around. So if you are working through your plan, you have to make sure that you're being consistent. So if one person who has been designated by the factors you have chosen should be back in the office and they have no medical or otherwise reason why they can't be there, you need to enforce your rules, because the moment you abandon them, you have no structure. And then you are open to, I wasn't picked because of my color, my gender, my whatever. And then the slippery slope is forever. And while my daughter has been doing a great job on her presentation on how to surf, which is a remarkable project for Ashburn in May, far from the shore, you don't want to be surfing around between every exception that every manager makes for their people. It's totally untenable. Adam, Cameron?
Great question, and I won't endeavor to answer it from your two perspectives, but what's interesting is that a good group of my clients are now pondering the question in a much more 30,000 foot level of should we even go back at all? Not just, a little later, but at all. And you find that in organizations that have been set up, be young ones or more established ones, they've been set up to kind of turn or pivot to the changes in market. Not because of this, but they used to be agile and they could pivot very quickly to take advantage of some possibilities in the market. They are best placed and poised to be able to actually, if the answer is maybe not, to figure out, okay, fine. So we'll be Twitter, we'll be, some other company that may decide to just be a remote work organizations. The ones that have basically a business model that is not built around immediate responses to the market are finding it much more difficult because they can't find equally profitable, if you will, or feasible ways to work in a totally new model and be it because they have realized an opportunity or be it because their people don't want to go back. Either of the case, that's very difficult for them. It's also difficult if their service involves a whole different set of involvement with the community, where although they can do their work technically speaking from home, but not really with some of the engagements that cannot happen online. And to the points that everybody made earlier, when somebody says, I don't want to go back, to the point that was made that's, there are many steps before it gets to a point of drawing the 6-shooter, is that the culture and the communication of the culture and the viability and continued viability of the culture is one way we can at least help that happen. Communicating to your people why going back is good or not good, whatever that is. Communicating to them what your plan is for going back will at least help toward making sure there aren't those, I'm going to, stomp my feet down and say what I want to say. So, but it won't avoid it. It won't eliminate it, but it will help it. So that's
Awesome. Thank you.
I'm sure.
All right. So I've got a couple other questions coming in here. What's everyone's take on PPE? Is the employer required to provide it? Can the employer force employees to wear it while they're at their desks? Any thoughts on that? I'll start with you, Matt.
So interestingly enough, and this is the lawyer being technical, but such is my life, PPE is not a face mask unless it's something high enough up the food chain that it's actually protecting you. So, your latestly acquired tie-dyed cloth face mask that your neighbor knit at their long dusted off sewing machine is not actually PPE. If you were providing N95 masks, which somehow you decide to pay 3 times market for, or someone wanted respirators, you thought, wouldn't it be cool if we were all wearing moon suits? You could do that. But OSHA only requires you to provide a generally safe workplace. And at the moment, the way that you would do that is by track with the CDC guidelines as best you can. Now, that sounds like an evasive answer, and the answer is it changes every day. Adam had the chart up there before, and there are ones tailored for different spots. But you have to be careful in terms of saying you're going to provide any PPE that someone wants, because people's imaginations are incredible. So you want to decide what you are willing to do. Am I going to provide surgical masks? Am I going to just mandate people bring in masks from home? Are you going to say wear a mask to the office, but you can pick up your mask when you get here? I think some parts of it go towards the idea of making people comfortable. So having a policy regarding masks, for example, is appropriate. But if you are not in a technical or medical setting, going in full-on PPE mode, despite the fact that people are hearing that all the time, may set a dangerous precedent, not only for now, but for things that you have to do in response to anything in the future. Adam, you have thoughts on that?
Well, we always talk about precedents in HR, so I like that you opened up the door for me there. One of the challenges, of course, with PPE right now is just getting it, right? So what if you say, okay, everybody, when you report to work on Monday, I'm giving you your mask, your gloves, and your spray bottle of cleanser. Can't wear one mask forever. Rubber gloves only last so long. So what if you can't get more? Now you're violating your own commitment. We ran out of gloves. We ran out of masks. Oh, now you don't have to wear it because yours is ripped, or you don't have to wear it because you left yours at home. There's always going to be that one turkey who leaves theirs at home. Come on, I know, right? So now all of a sudden, you've created yourself a rule, a process, a procedure, a precedent, and now you're violating it. And that's when you have to call my pal Matt over here, or I should say over here because he's on this side of my screen, and just get ready to write him a big check because he's going to have to defend you from somebody who's going to sue you because you told that you would provide the PPE and you eventually violated your own.
You can just send the big check. I'm okay with that.
Just send a big check. So, yeah, we do all we can, but just be careful. And remember, if you went back BC, right, pre-COVID, I used to work in a hotel, and we did safety training. And we taught people how to use equipment who were in engineering, and they were cutting and welding. And we taught people who were in housekeeping about how to use cleansers and chemicals. And the PPE we provided them were related to their jobs. Well, now we all need PPE just because we're going to work. Is that reasonable? Go back to what Matt just said. A generally safe workplace is the OSHA obligation.
Great. Thank you. So along the lines of screening, I guess we'll start with Matt. Can an employer force employees to be tested? And then Kamran and Adam, if you can weigh in just on if you have thoughts on screening, best practice, what you're seeing out in the market. So can an employer force employees to be tested?
So the EEOC has struggled with coming up with how they should do the guidance. And in fact, they had to dust off the H1N1 guidance that they had ginned up 10 years ago, which is crazy. That was 10 years ago. If you have reason to believe that a person is actually ill, i.e. they are demonstrating the symptoms, whatever else, you do have approval, whether we call it a blessing or not, under the EEOC guidelines to send them for testing. However, there is not at present any basis for you saying everybody has to get tested. Now, that may very well evolve. I think a lot of this guidance is based upon perceptions, whether they are realities or not, of the availability of testing. I also think that there is a fundamental difference between whether people are being tested for the virus or whether they're being tested for having the antibodies, because arguably if the people have the antibodies, then come on back, you're bulletproof. but we're not there yet. I think we're getting closer to there. I know that in Loudoun County, there was some tests offered yesterday for free for people, even if they were asymptomatic. Maryland has opened testings to that because, everyone's clamoring to go to a testing site with people who think they're sick, because that's clearly the best way to not get sick yourself. That being said, things like thermal scans and all those sorts of bits are efforts to try and minimize things. I would just encourage you to remember you're not doctors and you're not epidemiologists. And just because you watched Insert Favorite News Network last night doesn't mean that you have the answers either. So while we have a desire to sort of come up with a thing that we can buy or do that will solve it, kind of like the magic Band-Aid when you were a kid, the reality is it's entirely possible that there are people who show no symptoms who are giving the virus to many other people, and other people who have the symptoms that it's very mild. So the science will catch up. If it's not your business, don't try and claim to be an expert. And I saw a question in the comment box acting about, should HR have a more strategic role? AC. I'm going to have to adopt all this BC, AC stuff. HR should always be strategic. I mean, I have any number of conversations with HR professionals talking about how to get a seat at the table, and is this in the C-suite or not? I mean, the organization is its people, but HR is that part that people always seem to forget about. If we're talking about contracts, the number one cost in a contract is labor. If you act like a bunch of idiots in your return to work process such that no one wants to work for you anymore, and you win that contract and nobody wants to come join you, you now have real problems. And you're paying through the nose for recruiters to find people you have to overpay, and that thin margin of profit that you had is now a deficit, and you got it all by losing the hearts and minds. So be strategic all the time, and if nothing else, if you don't feel that your organization has been sufficiently strategic on the HR side, what better time could there be to step forward when you're looking at each other through, a 2-inch by 2.5-inch square video, as opposed to being the one at the 19th chair at the conference table? I mean, carpe diem.
Great. Conron, thoughts on screening? Anything you've seen or encountered in the work that you do?
It's interesting to follow Matt's comment about expertise and not playing a doctor. I've seen that evolution of approach and thinking in my clients, and it was interesting that in the beginning, to use one unnamed client, a client with 1,800 employees, went from, oh yeah, sure, the facilities is going to do the screening. And then after a while, I talked to them again about how their planning was going. And then it became, well, we actually we think we're going to have our security contractor, because their security is done by an outside company. We're going to have our security do that. And thank God they now said, we're going to have health professionals on site to do that. We're going to actually pay for nurse practitioners to come on site. And I believe, Will, that your organization, Gallagher, is also looking into helping people in that regard to figure out how they can bring that, how can they use their existing health insurance for that. But I see that happening. And part of the concern, which we should not belittle, is that they were worried about the just personal interaction of an employee taking the temperature of another employee, and be the one that says, stop, you're not going in. Your forehead is warm. And they said, if no other reason, that reason alone means we're not going to put somebody in the position of having to wrestle somebody out the door or be forever considered the enemy of employees. So I've seen that evolution, and whether that remains or some version of that, it's good to see that it's gonna be left, at least with my clients that I talk to the professionals.
If I just might add a logistics consideration to what my two esteemed colleagues here have said. So if you're going to do this, that means everybody who comes to work has got to be checked before they come in. So if you have different shifts, you've got to have people set up to do the forehead test. So that's what I'm going to call it for the moment, for all of those shifts. And as all the people are reporting to the workplace, they all have to come through the same door so that they can have their temperature checked. No side door, back door, front door. And oh, by the way, they all got to be 6 feet apart while they're waiting in line to have their temperature checked. And, okay, fine. What if I'm running late today? My kid was sick. I had a flat tire, whatever. So I come in an hour after my normal start time. Right? That happens all the time. In the old days, we wouldn't have even discussed it. Now I got to find somebody to take your temperature. Are you kidding me? Really? Like, just thinking through the logistics of this is starting to give me a headache.
Right.
And
Hey, Adam,
finally,
I'll throw a logistics angle at you as well.
go
Who's
for it.
taking that temperature?
Right.
I mean, I got
HR.
HR here on the call. This is the classic not in my backyard concept. I think it would be a great idea if we screened every single employee who came in by taking their temperature, because, you know, that's how we know that they're really sick. Who wants that job?
Right.
I don't want that job. You don't want that job. If the CEO thinks it's a great job, does he want to do it? Does she want to do it? Because a lot of these things are great as a talking point, maybe not so much when they're put into action, and actions matter. And if you've got leaders grumbling over your solution, that's not good either.
And then your employees are now believing, perhaps falsely, that they are safe because everybody that you let in did not have a temperature and did not exhibit any visible symptoms. But what we know from the media is that there are plenty of people out there who carry but are asymptomatic. No temperature, no symptoms. You let them in, they get somebody sick. Everybody stay home. Then I don't have to check your temperature.
I know that we're a couple minutes after 5 and people may have to move on. So I will mention just two, I guess, quick legal things to think about as you are coming up with your plan. Many businesses have taken on the Paycheck Protection Program loans. Realize that whatever it is that you are doing, you have to make sure that you are working within those confines, especially in terms of how the workforce is placed, who's on furlough, who's not, especially if you don't want to jeopardize the forgiveness part of that, because free money is way better than cheap money. And then the second part of that is Virginia, unlike DC and Maryland, didn't actually have a functional work share program in effect right now. So there's aspects of the current coronavirus relief acts that go towards the idea of work share programs being funded. Virginia did work it out. There's a flurry of other laws that were also passed, which we can talk about some other time. But the work share law is supposed to go into effect on July the 1st, just like the rest of things, even though it would only apply for a week. I have every expectation that Congress is going to be extending some aspect of that work share program, and realize that work share programs, as they are implemented, have a significant impact on how you're deciding people can go back to work. Because it's one thing if everybody is remote, but if you're having people start to come back to the office, who's in the office versus not can have definite impacts on that approved, and remember, it has to be an approved work share plan, and that has impacts on whether the government is paying part of your wage bill or if you're footing the whole thing. So again, another reason to write your plan down so you can catch those, oops, I forgot that moments.
Thanks, Matt. So we are a little bit after 5, and I don't see new questions coming in. So I guess what I'll do from here is, if you could give your thoughts on what the future might hold and how things might change for better or for worse in a permanent manner. And I'll start with Adam this time.
I guess the first thing that I would say is, prior to the coronavirus, the labor market was very tight, right? It was hard to fill open positions, couldn't find enough talent. We'd have a candidate, they would drop out of the process of the interview process to take a new job. That all went away at the moment because we've got this whole new concern and massive unemployment, et cetera. One of the things that those people were looking for when we were trying to get them in the workplace was some amount of telework, 2-3 days a week. That'd be one of the things they'd ask right out of the starting gate. How many days a week do I get to telework? That's not going to change. And they may even be asking for more telework. Maybe they're only willing to come to your workplace 1 day a week. They'll be like, I'll come in Wednesdays for meetings, but the rest of the time I want to be home. So I think we're going to be thinking about this not only from the point of view of working with our current staff, the people we know, the people already on the team, but we'll also see it as an issue for hiring and as we continue to grow at our companies. The next thing I think is the workplaces will be interesting, right? If I believe the term is hoteling. Nobody has a desk, nobody has a cube, nobody has an office. We have people who come in, they're there for a day and then they're gone, right? How do I set up my workplace so that I can accommodate not all my employees, but a certain percentage of my employees? And how are they able to work effectively? Maybe I need cubes, maybe I need open workspaces, maybe I need conference rooms. Now all of a sudden I'm working with vendors who do workspace redesign, and general contractors are knocking down walls. Nationwide Insurance, I saw they were going away. They're getting rid of a lot of their corporate space, and they're going to have a few regional hubs and a headquarters. Interesting. So are they going to allow new hires to have some money so that they can set up an effective, ergonomic, and efficient home workplace? Hey, you're not paying for electric and cubes and rent anymore, so all new hires get $300 to buy a second monitor and a cordless keyboard and blah, blah, blah. A lot of things we're going to have to think about. There's going to be a lot of ripple effects, and there's going to be a need for strategy, for budget analysis, and for real pro and con analysis comparisons here. This thing's going to be around influencing us for years to come, even when we're all healthy and back at work.
Excellent. Great perspective. Kamran,
So,
same question to you.
Sure. So since we just got done talking about not playing an expert when you're not, so let me play a psychologist. So if you think of just about any of these crises that we've experienced, you know, anywhere from the Spanish flu to the financial collapse to every one of these, I'm sure you've heard the term that was coined somewhere in the late 70s as a result of Vietnam War, the PTSD, post-traumatic stress disorder. Well, there's a twin to that, which is not popularly known, and that's a PTG, post-traumatic growth. And it talks about how when a person or a society goes through a major life-changing trauma, that after it, certain ones, and the jury's out as to who will experience this and who won't and why, but they will experience a growth that will enable them to face new challenges, do more things, become, you name it, something very positive, and that sticks, whereas the trauma often doesn't, but it sticks. So every one of those, every one of the crises, you can pair it with something good that came out of it, be it out of necessity or out of somebody or some process discovering that there was a positive outcome. So I think maybe it would be good to among all of the notes of caution we've poured on the table, to point out that there is also positive coming out of this, inevitable positive coming out of this. People are developing a closer bond. They feel more responsible. They gained more respect for the people who went out of their way to help. They've realized deficiencies in their process. The technology finally seems to have kind of stepped up and made many things possible. So for a business or for some view of the market, that's a very positive thing. So we, as business owners or leaders of businesses, are in position to look at that, and especially with a view of HR as a strategic part, not as a tactical part, to think about, well, how can we take advantage of this? This future we have, yes, we will have the concerns and the fears, but what else do we have? What else did you learn? What can we do? What other markets can we go to now that we realize physical distance was not an issue? So for me, that future is, in a way, once I shut down one part of me, is quite interesting and kind of, I'm excited to know how we can, once we cross this little, sorry, not little, but once we cross this blip in our history, what do we become? So let's also have something positive.
Excellent. Well said. And Matt, closing thoughts or something positive you can take away from this?
So given my chosen vocation and my admittedly dry sense of humor, it may not be self-evident that I am an unabashed optimist. I happen to think that WIS has, no one has more potential to make changes than humans. And at that, I think America has proven through many, many times that nothing is greater than a challenge to get us to new things. We are presented with an unprecedented opportunity to reinvent everything that we do, because nothing about the last 2 months has any precedent whatsoever, and has shown us that we can do things that we didn't realize. Now, that still means that you got to think about the future, and I'll bet you there's a whole bunch more laptops that are going to be bought the next time you buy computers as opposed to desktops. But this is a fantastic chance to take an organization in the direction that you want it to go and not be bounded by this is what we have to do. And I think if ever there was a time to have ears open and eyes open to new thoughts and new concepts and new ways of approaching things, this is it. And taking that chance and going forward to the future and not just figuring out how we can return to the past is a fantastic chance. And I think it's going to be seized by more people than not. And as we do that, I just think the future is way brighter. We may be focused on statistics now, but post-traumatic growth, I just think there's just growth. I think you have pent-up energy and demand. When your kids are saying, I wish I could go back to school, I'm sure adults are thinking, wouldn't it be great to see someone other than the people I decided to marry 2 decades ago? That's how it rolls. Be well, stay safe. I got the October 54th end of quarantine date behind me, so I'll be there.
Awesome.
Awesome. Thanks, Matt. One final question for you, though. Where could somebody access the checklist you referenced earlier?
If anybody wants to shoot me an email, I'll send it to them. Jackson Lewis is running a whole bunch of things off our website, so if you're not signed up for our updates, you would do that. But if you just want to shoot me an email, it's matthew.nieman@jacksonlewis.com. I'll happily send it to you. There's a bunch of resources that I referenced obliquely, which we can go in there. It's hard because one size fitting all is not obviously the way of our world. But I'm happy to send that checklist along. I know Adam had some stuff on his as well.
Awesome. And I'm happy to compile some information and send it out to attendees as well. So I think with that, we're wrapping up. There was a question about a recording, so I think we did record this, and we'll figure out the logistics of distributing that, and we'll have follow-up information. Obviously, this is a fast evolving time we're living in, so be on the lookout for Dulles SHRM updates. We're trying to adapt and get content out to our members that I think would be helpful and adapt on the fly. So we appreciate everyone who attended today. I'd like to thank all the panelists, and thank you to Brian for letting the chapter borrow his Zoom account and setting this up for us. I think it was, I definitely learned something new. So I hope everyone else did as well. With that, stay safe, enjoy the long weekend, and we hope to see you all soon.
Thank you all.
Bye-bye. Good luck. Take care.